Greetings to you all. I'm Nikranjay Kumar. I'm a second year BMS student in FNU Pacifica campus, and for today, I'll be presenting on a very specific parasite called Toxoplasma gondii. Now, for this parasite, I'll be elaborating very specific points according to the content overview of my presentation, which is in the introductory part. I'll be elaborating on what exactly is Toxoplasma gondii, its etiology, epidemiology, how it is classified. Then, I'll be explaining its pathogenesis, it's how what are the some clinical manifestation it causes. Then I'll be explaining how it is a life cycle situated. How what are the some lab diagnosis that can be done in order to identify this type of parasite, or how it can be treated, prevention and care steps, and lastly the reference from where I've accumulated all this information into my presentation. Without further ado, let's move on to the first part of my presentation, which is the introductory part. So first of all, what exactly is Toxoplasma gondii? Toxoplasma gondii is an intracellular parasite that causes a disease called toxoplasmosis, and it mainly affects warm-blooded mammals, especially humans. Now, moving on into its etiology. In its etiology, this type of pathogen or parasite belongs to a phylum called Epicomplexa, phylum, and its definitive hosts are domesticated or wild cats, and this host acts as a reservoir for them. In other words, this host basically harbors them and doesn't cause any infection or any disease to them, right? Moving on, how it is transmitted to humans, it is transmitted via four ways. First of all, it can be transmitted from humans via consumption of contaminated food or water by cat feces. Second of all, ingestion of undercooked food that has this tissue cyst of this parasite. Thirdly, vertical transmission from the mother to the fetus, and lastly, organ transplant or blood donation of from an infected person to a healthy person, and also in immunocompromised patients. Moving on to the epidemiology of this parasite, this parasite is highly prevalent in states such as Central, South America, parts of Europe and Africa. And the risk factors that increases the chances of getting infected by this parasite or have this parasite is first of all having a cat in your houses, in your homes. Second of all, dietary habits, consumption of undercooked meat, as I mentioned before. Occupational exposures such as farmers and veterinarians, as these people continue encounter this type of animals in their daily life, and also immunocompromised individuals such as HIV patients, or patients who have organ transplant patients, because in organ transplant patients their immune system is basically suppressed, right? Now moving on to the classification of this parasite. Parasite is classified under the order Eucoccidioida, under the family Sarcocystidae, and the genus Toxoplasma. Now, moving on to the clinical manifestation and pathogenesis. First up is entry and initial infection. As I mentioned before, when humans consume food that have contaminated, they contaminate a specific form of a virus, the oocyst. If they ingest oocyst in the contaminated virus, that's how they enter a person's body. And once this parasite enters the person's body, it starts to invade the whole cell, mainly the eyes, basically in the organs of the eyes, brain, and muscles. Now, in the acute phase, this parasite rapidly multiplies and causes cell rupture and spreads to other parts of the body. Then this results in symptoms that resembles to flu-like, right? And now moving on to the chronic phase. In the chronic phase, this parasite forms dormant cysts in the brain, muscles, and in eyes, which causes the immune system, which can reactivate if the immune system weakens. Now, the fourth stage, immune response and tissue damage. As the immune system tries to control the infection, in doing so, between the war of the parasite and the immune system, this causes tissue damage, right? And reactivation in the immune system leads to severe brain and nervous system issues and damage to the neurons of the central nervous system or the peripheral nervous system as well. Now, moving on to the clinical manifestation in immunocompetent individuals, they are sometimes asymptomatic, but they have mild symptoms with such as mild fever, headaches, muscle aches, or lymphoadenopathy. In immunocompromised patients, they often present with toxoplasmy, encephalitis, with headaches, confusions, motor weakness, seizures, pneumonitis, and myocarditis. Now, as I mentioned before, it mainly affects three organs: eyes, brain, and heart. But one of the organs I didn't mention was the heart. It mainly affects brain, eyes, and muscles. And in other organ that it affects, like one in a million chances, is the heart. Now, moving on to the third part, patients with congenital toxoplasmosis often have neonatal complications such as hydrocephalus, intracranial calcifications, and the rest is mentioned in the slide. I won't elaborate more on it. Patients with ocular toxoplasmosis, basically that affects the eyes, often have a choroiditis. Sorry for my pronunciation, which causes blood vision, eye pain, and potential blindness. Now, moving on to the life cycle. As I mentioned before, it has two life cycles: sexual and asexual. Sexual life cycle happens within the definitive host, where female and male uh, gametes of the parasite meets and forms unspotulated oocytes, right? Then, when these unsporulated oocytes are excreted into the feces of the cats, then these oocytes become sporulated into the environment between 1 to 5 days and become an infective stage. Now, in the asexual life cycle, if these sporulated oocytes have contaminated food, once they have ingested by the human, it will release sporozoids. Then these sporozoids will invade the intestinal cells and transform into tachyzoids. Then these tachyzoids will rapidly multiply and disseminate through the bloodstream to various tissues. As this disseminate to the specific through bloodstream to various tissues, they will mainly go to heart, eyes, muscles, and brain organs. These are the main sites there where this parasite mainly occupy and cause infection. Now, in tissues, tachyzoids differentiate into bradyzoids, forming tissue cysts. These tissue cysts remain dormant but can reactivate if the host becomes immunocompromised, as I mentioned before in the previous slide. Now, moving on, this is the diagram. Basically, summarizes the sexual and asexual reproduction part uh, of the parasite. I won't go over it because this is the basically summary of the previous slide, as I've mentioned before. Now, moving on to the lab diagnosis. Now, there are three ways that we can detect these parasites in a human body. Firstly, by doing surgical test, detecting specific IgM and IgG antibodies against these parasites. If IgM is detected, this suggests that the patient has been recently exposed to the parasite. But if IgG is detected in high amount, then this determines that the patient has later or indicates a past infection of the parasite. Right, now, moving on to the molecular methods, we can detect the DNA of Toxoplasma gondii in the amniotic fluids or tissues of the patients. via doing a procedure called polymerase chain reaction. This polymerase chain reaction is a procedure where it amplifies the DNA of the parasite in order to detect it, right? And lastly, direct observation, where microscopy comes in, visualization of the tachyzyoids in the body fluids or tissue sections of the humans of the human. Now, moving on to the treatments for acute toxoplasmosis. This in acute toxoplasmosis, treatment may be not required, but since because the individuals are commonly asymptomatic, but if they are to be treated, they are treated with medications such as pyrimethamine or other medications as mentioned there. Primary pyrimethamine is mainly used because this specific medicine works by preventing the cellular differentiation and replication of the pathogen, right? And moving on to the congenital toxoplasmosis, as you can see there, pyrimethamine is also mentioned, but another one is mentioned, that is pyramycin. This is mainly given to during pregnancy to women, and what it basically does, it prevents the formation of mRNA to prevent the formation of various proteins and the replication of the DNA of the virus. So directly also it also inhibits replication of the parasite. Now moving on, in immunocompromised patients. In immunocompromised patients, chronic suppressive therapy is used using the previous medication as mentioned before, but with folic, folilic, folic, folinoic, folicnoic acid. Right. Sorry for that. Sorry for that. In acute treatment, similar to immunocompetent patients, but often requires longer durations. So, because here the patients are often asymptomatic and present with mild symptoms. Now, moving on to prevention and care. Preventive measures that we can take is in terms of food safety, we can properly cook our meat. Uh, Second of all, we have to thoroughly wash our fruits and vegetables before consuming anything, and basically practicing basic hygiene or washing hands after petting your animals, such as for example cats, right? And moving on into care for pregnant women, we can do a serological test in order to identify if they have this parasite or not. In immunocompromised patients, we can routinely screen with prophylaxis or preventative measures, and we can another method is doing awareness campaigns by educating people, students, on what exactly is toxoplasma or toxoplasma gondii, how it is affected, and how it can be prevented. We are doing various campaigns, doing protests, and other methods as well. Well, that was all for my presentation. I hope all of you have gotten a specific idea or gotten some sort of bit of education from my presentation of what exactly is Toxoplasma gondii. And that's all for my presentation. And these are the following references, the main sites from where I've accumulated all my information from. That's all. Thank you everyone for listening to my presentation, and that's all basically. Thank you.